This presentation will discuss healthy child development as a social determinant of health. A child's early life experiences significantly influence his or her health and well-being in adulthood. The different domains of child development that have influence over one's life course include the physical, social, spiritual, emotional, and cognitive domains, all of which are interrelated. The effects of these domains on child development, coupled with experiences in adulthood, can be explained through three models: the latency model, the cumulative model, and the pathway model as described here. These three models coexist and remind us of the importance of controlling for confounding variables prior to, during, and following the assessment process. Our target population consists of middle-aged adults of an Aboriginal community in rural British Columbia. Our research is centered around the question, how did early child development and experiences influence adult health and well-being? To obtain a baseline, questions about current health and social status will be assessed via questionnaires, and a one-on-one interview will be performed for the mental health assessment portion of this project. Community stakeholders will be constantly consulted with to ensure culturally safe assessment practices. The first domain to be assessed will be the client's physical growth and development during childhood. Physical measures such as birth weight will be examined, as such determinants can shed light on risks to or incidence of certain health conditions that manifest in adult life. This information can be collected by utilizing a questionnaire with a box for written answers, available by mail, phone call, or online. Birth weight and birth length information can be collected by accessing hospital birth records. Likewise, health history will be assessed, such as immunization history, via one-on-one video or in-person interviews with a nurse and community stakeholder or elder, or by accessing health authorities' records for immunizations. Childhood physical activity can also be assessed via online, mail, or in-person surveys. Risky behaviors during childhood can be assessed via one-on-one interviews with a community nurse and, if consented to, a community stakeholder and/or elder. Due to the sensitive nature of this topic, an anonymous questionnaire can be sent out to community members as well. Maternal health can be assessed via video or in-person interview with an informant with the client's consent, such as another family member, or with the client, depending on the client's knowledge on this matter. Water security can be assessed by creating an online or mail-in poll asking clients what part of the community they grew up in. This can then be mapped out, and water sanitation systems can be evaluated using government mapping and water system data. In terms of food security, a community forum can be held for individuals to attend either in person or a teleconference line. Specific questions can be asked regarding dietary habits, resources available in the community, and accessibility to food. These answers can then be recorded on paper and collected at the end of the forum. Housing and environmental influences can be assessed via a survey, and the client's childhood geographical location can be assessed by looking at community maps. This survey is available online, in person, or by phone. The next domain that can be assessed within this population is childhood social development. Some factors that can be assessed for include household environment, such as incidents of abuse or neglect, family composition, social support, language and communication, income, education, employment status, intellectual disabilities, and bullying. These social factors can be assessed using a questionnaire sent via mail or email, which are then returned to the community health researcher's office. Language-specific community forums may also help, as it will enable community members to have a conversation with a healthcare professional, community stakeholder, and an interpreter regarding aspects of social domain, resources available within the community, and barriers faced. One-on-one interviews regarding family dynamics with a counselor present can also be arranged as a precautionary measure for responses to childhood trauma. Childhood spiritual development can also shed light on adult health and well-being. Attendance to spiritual ceremonies throughout childhood, participation in spiritual groups, mentorship, parents' and peers' beliefs are some spiritual factors that can be assessed via focus groups that are organized based on an individual's spiritual, cultural, and/or religious beliefs. This is to prevent fear of judgment by others within the small rural community. Community members can attend group sessions either in person or by video apps such as Skype. Emotional health during childhood can significantly influence adult health and well-being as well. Children who are exposed to early life stress are at a heightened risk for developing mood disorders and experiencing compromised intrapersonal and interpersonal relationships later in adulthood. Thus, it is imperative to assess childhood emotional health. Family influence on emotional health can be assessed via one-on-one, in-person, or virtual interviews with clients regarding childhood and current coping stressors, habits, and emotional regulation. Environmental influence on emotional health can be assessed via surveys about access to stable housing, crowding, recreational areas nearby, with geographical information then being mapped out using software technology to identify community landmarks in the vicinity of each client, such as parks. There is a substantial body of evidence demonstrating that low socioeconomic status, especially during early childhood development, is associated with high levels of depression, anxiety, behavioral difficulties, and other mental illnesses. Questions regarding parental employment and involvement, access to food security, income level, and access to disposable income can be addressed via an in-person or virtual one-on-one interviews or focus groups due to the sensitive nature of this topic. Childhood mental health and development impacts one's health throughout the life course as well. One-on-one in-person or virtual interviews can be held to assess the client's history of mental illness and previous attempts at self-harm, suicide, or harm to others. This interview or a follow-up interview can inquire about any changes to mental status, history of abuse or neglect, social support required, home environment, food security, academics, emotional regulation, physical symptoms associated with poor mental health such as a stomach ache, and self-esteem. A mental status exam can then be conducted to evaluate the current mental health of the individual. School records or an informant can also be accessed as part of the mental assessment to gain information on these topics. Community health nurses can also assess the individual's current cognitive function through the standardized mini mental status examination or the Montreal Cognitive Assessment, depending on their education level. A survey can also be sent out to assess their perceived quality of life during childhood. What was good? What was bad? What could be improved upon? What has improved over the years? What factors have influenced your current perceptions? An individual's experience with mental illness as a child and beyond can influence an increase to the risk of poverty due to lack of motivation or interest, and a withdrawn mental state influencing occurrences of underemployment or unemployment. To ensure we are capturing a holistic background for clients of our target population, a community forum will be held in person for community members to discuss the ways that historical oppression, post-colonization, or the lack of culturally appropriate mental health therapies experienced as a child affected their willingness to seek help from community and external organizations throughout their life. Family history for mental health disorders can be assessed through genetic mapping or one-on-one in-person or telephone interviews with clients as well, as some of these conditions can be hereditary. Questions about behavior management and peer groups can also be included as part of this interview. Some things for community health nurses to keep in mind during the assessment process to ensure community engagement include building a relationship of trust and collaboration with community members, ensuring questions are culturally safe, engaging the community through stakeholders, community input in assessment, planning, implementation, and outcome decision making, and discussing resources available within the community. Respectful conversation, promotion and maintenance of community's autonomy, as well as assessment of the community's thoughts towards visits and projects from external organizations are also important to be mindful of during the assessment process. Thank you.